welcome. I am Dr. Nadira Rambukas, the founder and president of Crown TT, and today we are conducting our Period Proud Education Series. We have a special guest today, Dr. Roshni Bissoondatt. She's a consultant obstetrician and gynecologist at Living Lady Limited, and today we'll be diving into a special topic about menstruation and the menstrual cycle wheel. Welcome, Dr. Bissoondatt.
Thank you.
So could you explain a little bit about the typical menstrual cycle?
So the menstrual cycle lasts average 28 days and is divided into 4 phases. However, no one is the same. So a menstrual cycle can actually be between 21 to 35 days, and that's normal. Each phase is associated with a different hormonal and physical changes. The first phase occurs between day 1 and 5, and this is where the lining of the womb or uterus breaks down and is shed through the vagina. This is known as the menstrual period. And then the hormonal activity is that estrogen and progesterone levels are at their lowest. Common symptoms include cramps, irritability, and also breast tenderness and fatigue.
So the second phase, what is it called and what does it entail?
Right, the second phase is called the follicular phase. Follicular because there are many follicles within the ovary. It occurs from the first day to the 13th day, and this is where the lining of the womb begins to rebuild. Follicles in the ovaries mature in preparation for ovulation. In terms of the hormonal activity, estrogen levels rise steadily, and the common symptoms that occur would be increased energy, improved mood, and greater clarity of your mental status.
Great. So we had the menstruation, which is the first stage, the second stage, follicular stage, and now we'll reach the third phase, which is ovulation. Could you explain what exactly is ovulation?
So yes, there's the third phase, and the third phase is called ovulation. And this occurs around day 14 of a normal cycle. And this is where a mature follicle comes out of the ovary, is released, and goes into the fallopian tube. All of this time, the lining is thickening. In terms of the hormones, there's a hormone called luteinizing hormone, and this is released from the brain, but it acts on the ovary, and this is what triggers that egg to come out, and this is why we call it ovulation. The common symptoms of ovulation would be heightened libido, clearer discharge coming through the vagina, and it becomes very stretchy, and there's also an increase in your basal body temperature.
Great. Thank you, Dr. Bissoondatt. So we have reached the fourth and final phase of a menstrual cycle, and can you explain what is the fourth phase of the cycle?
Right, so this is called the luteal phase. Luteal because that egg that comes out in the ovary is called the corpus luteum. So that's where the term luteal phase comes from. And this lasts from day 14 to 28. Basically, the womb of the lining of the womb starts to thicken, and this is in preparation for a pregnancy, because a pregnancy has to implant into your womb. If fertilization doesn't occur, then the hormone levels drop, leading to menstruation. And in terms of the hormonal activity, progesterone, which is the other female hormone, drops suddenly, and this causes the menstruation. The common symptoms are what we would call premenstrual syndrome or premenstrual tension. And these can include things like mood swings, anxiety, bloating, acne, cravings, breast tenderness, breast enlargement, headaches, and feeling hungry. So these are the typical symptoms that can occur from ovulation into the luteal phase.
Great. I want to thank Dr. Bissoondatt for being here today about educating us about menstruation and the menstrual cycle wheel. I am Dr. Nadira Rambukas, and we just learned about menstruation, the follicular phase, ovulation, and the luteal phase. As we continue our Period Proud Education series, stay with us.